Coming up on NPT Reports, Aging Matters, Dental Health.
When people say that having poor teeth is a cultural inevitability, that it's people's own personal responsibility, I say enough. We're not blaming the victims here of this disease. It's a bacterial infection and it's preventable, but not everyone has the same access to those prevention tools and that care.
Tennessee ranks 49th in oral health for older adults, a position that reflects high rates of tooth loss and a lack of access to affordable care.
I can deal with everything that comes along with aging except the loss of my teeth. To me, that has been the biggest blow to my happiness on this earth.
I think the prevalence of extractions in Tennessee states that we don't care enough about our community. And I think if we just spend a little bit more time letting people know the benefits of saving a tooth, we could save teeth.
In Tennessee, nearly 46% of adults over age 65 live with severe tooth loss.
For those people that don't even have dental insurance, they're paying out of pocket to start with, and dentistry is really expensive.
70% of older adults in the U.S. don't have dental insurance.
People die here in the United States because they can't get the dental care that they need.
It's time to recognize that the health that we have in our mouth is a reflection of the health of the rest of our body, and that it's all tied together.
Funding for NPT Reports, Aging Matters, Dental Health was provided through a grant awarded by the Davidson County Chancery Court, Part 3, from the Senior Trust Elder Trust Settlement, case number 11-1548, Part 3, and through a contract administered by the Tennessee Commission on Aging and Disability.
A smile says a lot about what we're feeling, whether we're happy or well, in good humor or among friends. But for many older adults, a healthy smile can feel like a thing of the past. Hi, I'm Kathy Matea, and on this edition of Aging Matters, we'll explore the relationship between people's oral health and their overall health. Let's begin with the good news. Dentistry's come a long way in the last century, and today's seniors are maintaining their natural teeth longer than in the past. The bad news? Older adults are often susceptible to gum disease and tooth decay, which can affect their general health and quality of life. That's especially relevant in Tennessee, where the state ranks 49th in oral health, and many seniors lack access to affordable dental care. How can we improve oral health in Tennessee? What treatment options are there for seniors with dental problems? How will older adults access and pay for dental care, particularly when they lack insurance? And what more can be done to ensure older adults live a full life with a healthy smile? Join us as we tackle these questions on Aging Matters, Dental Health.
Small cavities will occur in your teeth from time to time, so you should visit your dentist regularly for a checkup.
The first time I remember going to the dentist, I was in the 3rd grade. I don't remember regular appointments. I think you went to the dentist when you had a toothache. Oh, that my girl. Dentistry was, I don't want to say primitive. If you had a cavity in your tooth and it had to be drilled, we really should have had a seat belt on. It was not much fun.
You can have good teeth if you take care of them.
Born in 1925, Eleanor Dudley's early experience with dentistry left a withering first impression, and throughout much of her adult life, dental health was an afterthought.
So I didn't pay any attention to prevention. I know that I never heard the word dental floss, I guess until I was married. I didn't have, I think, good instructions on brushing. I just put the toothbrush in there and went I don't know if that contributed to gum disease or not. It probably surely didn't help.
By the time Dudley reached her 50s, her oral health was in decline, and she realized she needed to do something about it.
As I got older, I more and more valued having teeth that worked. I would hear some people around me, friends about my age, saying, well, I remember when I'd bite into a good, hard, juicy apple, but I can't do it anymore. That kind of impressed me, the fact that I like a nice, juicy apple, and I'd like to keep on eating them.
For older adults, maintaining good oral health means more than just brushing and flossing. It means taking into account one's overall health.
Aging has been associated with tooth loss and gum disease, mainly because the general health changes in a person as they get older. Their progressive chronic diseases may not have affected them so much when they were younger, but now that they're older, they're really starting to affect them.
Our mouth is connected to the rest of our body. The inflammation, the infection that's in our mouth can affect the rest of our body. So poor oral health can increase our risk of heart disease, stroke, and certain cancers, and it can make our diabetes worse.
We've always thought of dentistry as being separate from medicine. In medicine, inflammation is a big part of the disease process of chronic diseases. Because of the new research, we're finding associations between inflammation in the mouth and systemic diseases. So now it's not just you need teeth to chew and swallow, you need good oral care so that you don't increase the risk for cardiovascular disease, stroke, increased progression of Alzheimer's disease, aspiration pneumonia, not to consider nutritional deficits as well.
Dr. Howard Cowan is director of the Geriatric and Special Needs Dental Program at the University of Iowa College of Dentistry, one of few geriatric certificate programs throughout the United States. Cowan and his colleagues are leaders in the field of geriatric dental care.
How are you today? Our main mission is to train these dentists so they can go out into their communities to understand the needs of the elderly and feel comfortable providing that care for them. And I think all dental schools could do that same thing.
But geriatric dentistry is not a specialty recognized by the American Dental Association, and a few dental schools offer intensive training to deal with older adults' evolving health needs. Educators like Dr. Jennifer Hartshorn argue that older adults deserve specialized care.
We're looking at people individually, saying, what is your risk of having deterioration in your mouth? And we always notice that when we see that change in oral health, it's tied to an event in their general health. That event could be a new diagnosis. Maybe their chronic diseases had progressed to a stage that they needed more medications to manage it. And we're always teaching the dental students to look for those changes.
You're taking a lot of significant medications. Some of them specifically that would have an effect in your mouth. I think there's a range of almost 200 medications that can cause your mouth to be dry without the saliva in your mouth. As you eat foods, the acidic byproducts aren't cleaned out. You're much more susceptible to decay, to your tissues not being hydrated properly, and that then compounds the issue even greater.
Conditions that affect mobility and dexterity can also impact a person's oral health.
I have arthritis primarily in my hands. It makes it more difficult to do things. My grip isn't quite as good when I try to pull the floss back and forth between my teeth. It's a little harder to do.
Sometimes a simple change can make a big difference. Dudley's son-in-law recognized that the effects of arthritis might make it difficult to hold and manipulate a regular toothbrush. So he bought her an electric toothbrush with a large, easy-to-grip handle.
I had never used an electric toothbrush before my son-in-law gave me one. I probably don't use it quite as often as I should, but when I do, I'm very conscious of the fact that my teeth feel slippery and clean, and I like it.
Our teeth are connected to the rest of our body. And as things happen, whether it be side effects from medications in a dry mouth or limited mobility, we've got to find a way to continue to do the oral care maintenance that we've always done throughout our life and make those adjustments.
Prevention is really key. It's one of the things that I stress most often. You know, keep going to your hygienist, keep going to your dentist and have things checked out. that fluoride application once a year, twice a year can really make a difference for these people.
Okay, well, I can report that was a pretty good checkup.
Telling older adults they need to go to the dentist is one thing, but getting them into the chair is another. Dr. Rhonda Switzer-Nadazdi is CEO of Interfaith Dental Clinic. Established in Nashville back in 1994, its mission is to provide complete and affordable care to the working poor and older adults.
All right, thank you.
No problem. There are lots of challenges in caring for older adults in Tennessee. We have high poverty rates, we have high rates of heart disease, etc. You could say it's our culture, but it's really about access. Dental care is not available if you don't have the funds to get it. It's simply not there.
Once you retire from a job, you lose your dental insurance a lot of times, and then Medicare does not provide you with dental insurance. And so they're paying for it out of pocket, which hopefully they have saved money for over the years.
It neither makes biological sense nor policy sense that oral health isn't included in Medicaid for adults or for Medicare. Now, some states have gone ahead and made it be part of Medicaid for adults for dental, but Tennessee has not. So if you're over age 21, there's absolutely no government assistance through your Medicaid or Medicare to get dental services.
At Neighborhood Health, a community clinic, Dr. Michelle Blackledge often sees patients who've avoided the dentist because they didn't think they could afford it. Her clinic is part of a patchwork of community providers who are trying to meet a growing need.
I think most people come in here for dental pain. That's usually where we see people is at their lowest. So you're trying to eat on gum tissue. Gum tissue is not meant to be eaten on. I think people wait, especially our older generation, they wait till they get into a situation that they can't handle.
So when I got into my late 50s, I was feeling, when I would brush my teeth, a lot of tenderness in my mouth. And then when I eat food, it got stuck into my teeth. I started feeling the pains through my gums, and it got into my head and my ears. So I started having an infection.
The experience took a toll, not just on Zelda Freeman's oral health, but on her general well-being.
I just was irritable talking to people, but nobody understood why I was so cranky. It affected my relationship with anybody that was close to me.
Her oral health may have been associated with other chronic conditions as well.
My blood pressure was high a lot, and my thyroid was out of balance, and the diabetes was just on the borderline.
For Freeman, things were getting worse. Despite a recommendation from her doctor, she continued avoiding the dentist.
I was scared. The thought was, oh, I'm going to have a lot of pain. It just made me feel, I don't want to go through this.
When she finally did work up the courage to go, she was afraid of being turned away.
At the Neighborhood Health Center, I went to them and asked them, how can you help me, a person that doesn't have insurance? Appointment and email.
What I often get is people saying, well, I can't afford it. And that's why community health centers are so important, because we are on a sliding scale. We will make arrangements. We were going to take care of you, but we don't want to see you at your lowest point, because that means that you probably have other things going on.
Unfortunately, Freeman had waited so long to go to the dentist that many of her teeth were beyond repair.
I had to have quite a few teeth pulled.
So we've got all the teeth out.
And it left me with 15 teeth, a few at the top and some at the bottom.
And so now we're looking for you to be able to eat and do all the good things that you used to be able to do again. Okay. So no more bad teeth. Deal?
Deal.
All right.
In Tennessee, more than 20% of people over 65 have all their natural teeth extracted. That's compared to less than 15% of all Americans.
All right, let me take a look. Every day I see someone who comes in that has to have a tooth pulled. And I wish that wasn't the case, but every day I extract a tooth. That's an issue because I think it becomes part of a monetary thing. Is it cheaper to get a tooth pulled or cheaper to get a tooth filled? And people will say, you know what? I'll pay $25 to get that tooth pulled versus $1,000 for a root canal and a crown.
Older adults face a culture of extraction across the state, but a handful of charity clinics have expanded their reach and make restorative care more accessible to the working poor. Dr. Laurie Hodge is the dental director at Church Health,
How are you? Good to see you.
a comprehensive health care facility in downtown Memphis.
In the U.S., if you don't have the financial means to access dental care, then you may not ever see a dentist. Being a nonprofit that's able to offer not only emergency but restorative and comprehensive care for people can show that there's another way to do this, that we are able to provide that dignity and hope to those people that otherwise would never have access to this care.
Just a few weeks ago, I was at a very low point in my life when I came to see the doctor here at the Church Health Center.
Okay, just a little bit of movement here.
I'm an Uber Lyft driver. I drive full time.
How are you?
Good, how are you?
Wonderful, wonderful.
I'm gluing my teeth in every day so I can go to work. It's embarrassing, but there was just nothing I could do about it. I can no longer afford to go to the dentist in America. It's out for me. I draw my Social Security, but that only makes my house payment. I don't have any other money to pay my bills with. I'm struggling.
For the majority of Donna White's working life, it wasn't this way.
I had a very, very good dentist for 25 years. But since I was a server for 46 years and had no access to dental insurance, I got behind.
But that is for one of your older crowns.
The dental work White had done 20 years ago was starting to decline. Not only were White's dental issues affecting her outlook, they were directly affecting her diet and overall health.
I couldn't bite because my veneers would pop off. I'm down to eating ramen noodles and soft things. I'm 64. In the last few years, my blood pressure has gotten higher. My cholesterol went up. I am pre-diabetic, but I think that my missing teeth and my low self-esteem made me not care about what I was eating.
Elderly people often live under the stigma that they don't deserve to have their teeth look great. They feel that social isolation a lot of times because of how their teeth are. Nutrition-wise, for a lot of our elderly patients, if they've lost a lot of teeth, they can't eat or chew, which we know that will affect their quality of life long-term because they're not able to get the nutrition that they need, and so then their health is affected negatively as well.
Today, restorative treatment options are better than they've ever been, offering people an alternative to dentures. But they do come at a cost. And for those with limited income, restorative treatment is simply out of reach.
I don't mind paying for my dental work. I just could not afford a private dentist anymore. The dentists at the Church Health Center are going to completely restore my smile.
That canine, I'm going to raise him up just a little bit for you.
And it will be a fraction of what I would have paid at the private dentist.
Just a water bath.
Everything is going to be repaired in my mouth. I got two crowns prepped last week, and they're going to have those crowns put on today. and I can eat salad now, which is really good.
Smiling with confidence now.
Okay.
Being able to have a place where we stress restorative care, we can actually provide restorative care at a cost that's affordable for patients is a big deal in cutting off that cycle and that psyche of that, I've just got to get my teeth pulled, it's that time. This is what everyone in my family has always done since the beginning.
You want to see him?
Yeah. I know that having my smile restored is going to make me a much happier person. I want to work, I want to smile, I want to be healthy. And I think in order to be healthy, you have to have healthy teeth.
That looks great.
It looks great.
But outside large cities like Memphis and Nashville, there are few safety net providers, and the sheer volume of need often goes unmet. Nowhere is this more apparent than in rural communities, where geographic barriers further challenge access to care.
So all of this is going to Emporia, Virginia.
Stan Brock is founder of Knoxville-based Remote Area Medical, also known as RAM. For years, RAM has been providing free dental, vision, and medical care to far-flung communities around the world.
We're supposed to parachute into jungles in the Amazon and Africa and places like that, and indeed we do. But pretty soon, people started asking me, well, we need help in our county here. The first time we were asked to perform a RAM event here in the United States, in fact, was in Tennessee, in a little place called Sneedville, where the local dentist had just left town because there wasn't enough business, in his opinion, and the local hospital had just closed. About 150 people showed up, and they were all adults that needed their teeth taken care of, and most of them needed extractions.
Here at a RAM event in Jefferson County, patients line up the night before the clinic opens to receive care that is otherwise out of reach.
What individual, average working individual, can afford $400 to get her tooth pulled?
Without insurance or access to a charitable clinic, some surgical extractions can cost up to $600, forcing people to live with the pain.
To the people that come to our clinics are coming to see the dentist. Of course, the older they are, the more serious their problems. I mean, we're seeing people in the age group 50 and 60 that have never been to the dentist. And their teeth are just a terrible mess. And we have to remove every tooth that they've got.
Like other charity providers, RAM relies on donations and volunteer services to do this work. Based on event turnout, Brock continues to believe this brand of benevolent care is critical. But is it a long-term solution? Even he questions that logic.
Why are we doing this in the world's richest country? We're glad to do it. It's necessary. We'll keep doing it as long as it's necessary here in the United States. And hopefully, at some point, we can work ourselves out of a job here and go back to concentrating in places like the Amazon and Africa and places like that.
With current numbers, it may be a while before RAM uproots. 70% of older Americans don't have dental insurance. With little access to dental care, many older Tennesseans are forced to live with tooth decay and gum disease.
I have never met anyone that said, gee, I like my teeth being rotten and I don't want to do anything about it. It's helping people have the ability to do something about it and to keep their teeth for a lifetime. And it takes a system.
In Tennessee, there is no system of dental care for low-income older adults, but that is about to change, albeit on a limited scale and for a limited time. Interfaith Dental in Middle Tennessee is building a network of charitable clinics across the state to expand the scope of care for older adults.
It's a way of building a network of the safety net clinics that already exist, and this involves dental schools, mobile units, federally qualified health centers, faith-based clinics like Interfaith Dental, being able to take on an increased number of older adults into a system so that there's ways of attacking the problem that's unique to each individual older adult.
More than just dental visits, the goal is to pool resources and overcome barriers to care, from affordability to transportation and education about preventive care at home.
So you actually want to start with these bristles at the gum line.
We hope that it serves as a model to our state and to those that are in the legislature of how we can provide care at a reduced cost to those that are aging, because they often don't have any other resources for that.
And you have clean floss.
The network, called Smile on 60 Plus, will reach 20,000 unique adults over 3 years, but that only covers 10% of the estimated need, and that need is only going to grow. Since 2011, every day 10,000 baby boomers turn 65, and for nearly half of older Americans, Social Security is their main source of income. Charitable organizations may be able to test an oral health care solution, but experts suggest bringing a network to scale will require changes in public policy.
The easiest way to provide this care would be to add some dental benefit within the Medicare program. Emergency care, preventive services, restorations, and maybe even limited, denture types of care. And that would be the beginning. At least they would have the ability to say, I have some insurance.
According to Switzer, it's a matter of priorities.
If older adults are covered, if you eliminate the financial barrier and they have access to clinics, they will get healthier. It's time to recognize that the health that we have in our mouth is a reflection of the health of the rest of our body. Having good oral health shouldn't be a privilege. It should be something that all of us can access.
We've learned a lot about what it will take to maintain a healthy mouth and, as a consequence, a healthy body. What we can do as individuals is important, but if we're going to change the state of oral health in Tennessee, it's going to take a broader effort. For more information and to see all of Nashville Public Television's Aging Matters series, visit our website at wnpt.org/agingmatters. Thanks for watching.
Funding for NPT Reports, Aging Matters, Dental Health was provided through a grant awarded by the Davidson County Chancery Court, Part 3, from the Senior Trust Elder Trust Settlement, case number 11-1548, Part 3, and through a contract administered by the Tennessee Commission on Aging and Disability.